And now it's my great pleasure to introduce a real expert on the NHS, a great, has become a great friend of mine since I became the Shadow Health Secretary. She's a tremendous campaigner. If you're on Twitter, please follow @DancingTheMind. Have I got that right? She is a psychiatrist. She's such a passionate defender of our NHS. Please welcome Dr. Lauren Gavagan.
Hello, London, and thank you for coming here today. My name is Lauren Gavahan, and I work as a doctor in your NHS in mental health. This year marks a decade of my working as a doctor and 70 years of our NHS. In my time, I've witnessed the very extremes of life and death, for this is what we do. We are there in those extraordinary moments, many, many of them, of inconceivable suffering, but also moments of love, wonder, and tenderness. I have been privileged to be the first to pass a newborn baby to his mum. I've also been there in the silence of the early hours to listen to the last beat of a beautiful old man's heart. There are little details too, a memory of the skin stretched white over a mother's knuckles as she hears for the first time her daughter talk about how she was raped, and the million creases appearing on a man's face as he finds out his sister jumped onto the tracks, though survived. You see, these moments, these people, these images, they never leave us, but they become part of our tapestry as doctors. And each of them, no matter how dark, provide great opportunity for humanity to exist in our health service. And for me, they come flooding back when our work, our NHS, is undermined and disrespected. Our NHS is incredibly precious, and I think it is almost impossible to conceive of it not being there for us. But it is under great threat from this government, who are failing in their duty to keep our health service running and have pushed it into crisis. I could rattle off countless statistics, but I fear we have become somewhat numb to them. And I think that's what this government wants, for us to simply look the other way. Nevertheless, some of the numbers are staggering. 4 million people are currently on surgical waiting lists. 4 million. We have 40,000 nurses short in our NHS. And since 2010, 15,000 hospital beds have been cut. But what do the numbers really mean? They mean that the humanity is being sucked out of our NHS. They mean that this year, an 81-year-old lady died in her home after waiting almost 4 hours for an ambulance. They mean that people are dying on trolleys in hospital corridors in England in 2018. This is not normal, it is not safe, and we must never accept it or begin to normalise it. It does not have to be this way. And the creeping privatisation of the NHS need not continue either. 400 contracts have now been outsourced to Richard Branson's Virgin Care. Martin Luther King said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Let us not forget this. Let us work together to restore an NHS where staff and patients are happy and looked after. Let us refuse to allow this government to take the humanity out of our NHS. Let us do everything we possibly can to fight for the NHS. She's worth it, and in her 70th year, she deserves it. Thank you. And now, I would really love to introduce Debbie, who is one of the NHS's incredible paramedics.
Thank you. Wow, I'm loving this. This is great tonight. Hello, my name's Debbie Wilkinson, and I've been an NHS paramedic in Leeds for 27 years. Thank you. I recently worked it out. That's more than 35,000 addresses I've visited on 999 calls. That's when you feel old. It's a job I love and I'm very proud to do. And I know we're respected and trusted by the public. I was very nervous to speak here tonight, but I know I'm among friends. Everyone who works in the NHS is united by pride in what we do, but also by feelings these days of frustration, helplessness and guilt. Believe me, it's stressful enough attending a 999 call on blue lights and sirens, never knowing what you're going to find when you get there. But more and more these days, when we do get there, we're greeted by people saying they've been waiting hours for the ambulance. Cuts in social care and mental health teams in the community mean there just aren't enough staff to provide the kind of rounded support we want and need to. So more people end up going to A&E as the default because we can't refer to pathways and do what we want to do and enable patients to stay at home. But when we get to A&E, our hearts sink. There are so many patients waiting in corridors. Even this week, my local A&E department was packed to the rafters. Just yesterday morning, I started at 6 o'clock and at 7, the department was full with people on hospital beds and trolleys. With genuinely poorly patients around the clock. Horror stories about waiting hours to transfer patients from our care or even out of the vehicle into hospital used to be rare. Now they're the norm. While we're waiting, we can also hear our radios screeching with the control room asking if anyone else is available to attend yet more 999 calls, because while we're waiting in the corridor, we're not out there attending to people. The guilt and frustration are exhausting. I used to go home feeling like I'd helped every patient, every single patient. I'm ashamed to say I don't get that feeling anymore. I don't feel I've done my best by those people. The stress and guilt builds up and it ends up making you ill. I've just been off sick myself, and while I was off, every time I heard a siren, I got upset because I wasn't there helping my colleagues and helping patients. But I couldn't have been at work because if I'm not on my game, people die. We've endured 7 years of pay cuts. I live alone and I'm struggling financially. If I don't work at least one day of overtime a week, I can't manage. That's not to mention the extra hours we have to work after each shift and the missed meal breaks that we take. It's no good this government telling us how much they value us and then refusing to give us a pay rise after big events like Manchester. Thank you. After big events like the Manchester bombings and big events like those, don't give us those platitudes. I'm afraid hypocrisy doesn't pay my mortgage. Thank you. So when I was at work over the last couple of days, I asked some of my colleagues in A&E, what feels different this year? Why is it so bad? Their answer was simple. The crisis we've all been expecting has arrived. Sheer numbers are overwhelming us, but with no extra funding. This year, our beloved NHS has its 70th birthday. It is as cherished and successful as it has always been, but this government is trying to break it and sell it off to the highest bidder. The staff keep it afloat with goodwill, but that only goes so far. We can't do it forever. Only a Labour government can save our precious NHS, and I, for one, am willing to fight to preserve it. Thank you. Thank you. Thank you very much. Thank you. Thank you. And I'm now proud to introduce another one of our family. Our next speaker is Siobhan McCullough. Thank you.
Hello London, and thank you for having me here tonight. I'm actually trying to hold it together a bit because I don't know about you, but I'm feeling quite emotional. As a nurse, quite often we don't feel very valued, and coming out here tonight, I'm just full of love. I'm feeling valued and so thank you. So I'm a specialist nurse in the NHS, and I've worked in the NHS for 18 years. It was my first proper job, and it is my family. Like all families, there are many characters, and we don't always agree. But we are united with a commitment to care, to do the best we can to look after you when you or a loved one are most in need. But our NHS family is being systematically dismantled by this government, and we all feel the effects. Look at what happens when routine operations are cancelled. Often people have to stay off work for longer, and many become depressed. Look at what happens when social care visits are cut. Our older people do not get their meals delivered by fairies. They're more likely to become lonely, isolated, more unwell, putting more pressure on other parts of the health service and the social service. Our work isn't just about emergencies and drama, like you see on Holby City, although some of that is true. It's mostly about prevention. Making our society healthier is cost-effective in the long run, and we all know that to be true. I remember the general election when Theresa May told a nurse on TV there was not a magic money tree to give us a proper pay rise. Well, they found it soon enough, when they needed £1 billion for the DUP so they could cling to power. It's an insult. When I heard that from the Prime Minister, and I know colleagues, friends who are suffering from stress, anxiety and depression, myself included, for the first time in my adult life, requiring 6 weeks off work and cognitive behavioural therapy to try and deal with the stress and anxiety I had from my work. And having, like Debbie said, having to acknowledge that to my colleagues, I was ashamed, embarrassed, that I couldn't cope at that time. It's utterly sickening to hear these sort of feedback from the Prime Minister. It's not perfect, but I'm incredibly proud of the NHS, and I know we all are. We are not failing. We are being failed. We are being battered by cuts and privatisation. And I can promise you we are doing the best we can under the most difficult circumstances I have ever seen in my working career. But I have hope. We can reverse the damage being done to our health service. That's what we do. We fix things up and we make them better. Our NHS, I believe, is not beyond repair. We need investment so that this most precious public service is run for the public good, not for private profit. I believe our NHS is this country's greatest achievement, and we must and we will defend it. Thank you.